So I got just short questions.
Yes.
First, we all know that there are specific effects and non-specific effects of acupuncture, right?
Yeah.
So, what do you think about the non-specific effects? What do they do to acupuncture, and how can we, utilize them to in practice?
Yeah.
How can we use that?
I think part of the so-called non-specific effects are specific, in the sense that I think what we are doing is that first, I think in a clinical practice now, not research, but in clinical practice, patients coming to see a physician or acupuncturist is worried about his condition. So he's basically driven by worries and by unpleasantness. So the two driving forces are emotional and cognitive. So that's the main reason to seek the doctor. And I think that if you as a therapist then examine the patient properly, and I don't think it's really important if you do it in Western perspective or Eastern perspective. I just think that the time you spend with the patient, examining them, gives them you are seeing the patient for whom they are. You follow? So what I mean is that the patient is allowed to express their worries. And if you then can communicate any kind of therapeutic relationship, in other words, by seeing their problems, you see them. It's kind of empathy, mirror, neuron related. But this will not determine how good you are as a therapist. So basically one part is that you recognize the problem and you can communicate that with them. And you can give an explanation to possible causes, Western or Eastern. But then, so I think this is part of it. That's the first part. The second part is what you are doing when you are treating them. In other words, it could be simple touch. But I think then by putting a needle, evoking that chi is a stronger response, as long as it's not painful. So basically what you're telling someone, if you're a friend with someone, you say, hello, this is like this is like empathy-mediated communication, just with eyes, basically, or hand, little bit. But when you touch the patient like this, then you have another effect. These are other centers being activated. So possibly this will change the functional connectivity in the brain. So empathy, that could be two parts of the brain activated, like the prefrontal cortex and, say for example, the part of the hippocampus, or endomygdala, of course. But the other one, when you touch them, touch deactivates, or as shown by Professor Lawson, possibly reduces the activity in the stress-related. Then by doing that, you allow for another effect of your needle. Did you follow this? So I think by with your acupuncture, you're basically telling the patient very clearly that you are going to get well. And you are going to get well is when you stimulate the needle. It is a strong sensation, but it's a positive one. So it's stronger than giving massage. So I think that's specifically related to acupuncture. I think you can get the same effect with other treatments, but not as good. So it's a continuum with light, so therefore you can get the effect with also with light touch. But if you go in more intense, you get better responses.
Okay. So what is it about acupuncture that it's more intense than massage? I mean, you can do massage very intensely too.
Yeah, I think, but the problem is first you get deeper, so I think deep stimulation is more effective, and it's a purer stimulation. When you do massage, you have A beta, afferent, and you also have a little bit of A delta, possibly C, but especially those. But when you have A delta activation, like when you stimulate needle, it's A delta or C, mainly A delta, I think. It's a pure stimulation. I think the other one is like a noise signal. So it's too much sensory input. So I think if you can have a pure sensory input, that gives you a better effect. Purer.
Pure, more pure.
Yeah.
Thank you. And
what do you think of the role of self-awareness can produce the acupuncture effect? Can you mention about that?
How do you mean?
Lower role of awareness of the self.
Yes. Yeah, lower awareness of the self. Yes. Yeah. I think that's in many patients you will find that they have a reduced awareness of themselves, and I think you have done that in your studies. trying to look for different aspects of awareness. I think that if you take yourself, you yourself are basically a construct of how you interact with others. So if your personality starts to disintegrate, like in chronic pain or chronic stress, you don't feel that you are yourself. By adding your needling you reconstruct the self, because you basically are then sending signals in that the brain can recognize, and they are strong. So I think a lot of the secret with acupuncture is the strongness. I think you could use moxibustion as well. And the problem is that we have difficulty controlling it. So I think that would be very interesting to do, because I think it's another pathway. So that would be something to look for. I mean, regulated, controlled heat stimulation without evoking a lesion.
Can you comment on the magnitude in terms of therapeutic effect? Can you comment on the magnitude of pure stimulation, acupuncture stimulation, and the others? I mean, patient-doctor interaction.
Okay.
It sounds to me that all you mentioned about touch or any consultation or something, it belongs to patient-doctor interaction relationship.
Yeah, I agree. I think
can you comment on the magnitude?
Okay, that's different. I think there are two different things. The first, doctor-therapist relationship is one thing, and
doctor-therapist?
Doctor-therapist or therapist. I mean, sorry, no, doctor-patient. The doctor-patient relationship, that's more about the self. I mean, what you're doing in the patient is that you reconstruct the self. And that is more mechanism related to empathy-related mechanisms. Whereas healing is mediated more by compassion-related mechanisms. I think they are quite different, actually. So there are other structures being activated, and I think what you find within healing is that there's much more reward. So if you're a good person, so you should look for reward mechanism, actually. So if you're a good patient giving good reward in your therapist, that is rewarding you as well as the society. In other words, it's a benefit to be a good treater, because you get more patients, but also the patients become better. So I think there is a cost benefit into being that. So I think you're doing two different things. If you talk about magnitude in the stimulation, I still think that the compassion, you need much more to tune into the patient's level of anxiety and hyper-responsiveness. Like Harris showed the first day, I think this is very true. If you have a hyper-anxiety person, very worried, the whole nervous system is super sensitive. So then you need to go down. So I think it's a good suggestion. Either you should do heart rate variability. The ones that are likely to respond are the ones showing a decrease in heart rate variability. In other words, a decrease in sympathetic tone. Whereas the ones that are not responding are the ones that don't change. Or you could use this thumb test that Harris was talking about to see if they're hypersensitive before, and then do lower stimulation. Or you can do electrical threshold measurements, like Irene Lund was talking about. It's fairly similar to the other one, and that could give an indication of how much you need to stimulate. So I think the magnitude is dependent on the patient. But you should be, in general, you should be as strong as possible, but just below the level where you evoke the opposite reactions. So I think because when it comes too strong, you will have totally the opposite effect. And that, I think, is along with what Kathleen Wee showed. In her study, she basically showed that the stronger the better until we reach the level where you have the opposite effect. So I think that those studies are quite clear on that, I think.
Can I ask you one?
Yes.
So in the presentation, you talked about pain intensity and unpleasantness related to the pain.
Yes.
So how do you evaluate unpleasantness, the methodology? I'm curious.
I think when we did it the first time, it was rated by Voskes, asking for, or numerical rating scale, basically asking for unpleasantness. Maximum unpleasantness.
Is it from like 0 to 100?
Yes, up to 100. Or like either a graphic rating scale, but we also had then questionnaires. rating unpleasantness. That's a Swedish local scale.
Oh, beautiful.
But I think you can use the Voss scale, it's good enough.
Oh,
Some regular Voss scale
regular
is
Voss.
good enough. There are, I think, the unpleasantness. The typical thing with the unpleasantness, when you ask the patient, is that they will say, the unpleasantness is a sensation or emotion I have in all of me. Either it's in my stomach, it's in my heart. It's not predefined by location. Whereas pain intensity is defined by a specific location. So you can definitely do that. So, and I think unpleasantness, also shown by Cecilia Norbrink in our presentation on spinal cord injury patients, that it was very clear that when you compared massage and acupuncture in these patients, the unpleasantness component was the big difference. So I think unpleasantness is important. Also from cost, if you look on society, because that is what takes the patient to the doctor. It is the degree of unpleasantness. Of course, when you lack control. So I think that is okay.
Okay, great. Thank you.
No problem.
Thank you.
Thank you for your time.
Yeah. Thank you.